Welcome to Season 2 of Healing the Tigress, a podcast of conversations and stories on Asian American Pacific Islander maternal mental health. We are your hosts, Peggy, a perinatal mental health therapist,
and Jasmine, a clinical pharmacist who is perinatal mental health certified. As Taiwanese American mothers who lived through postpartum depression and anxiety, we felt like we didn't hear about other AAPI mothers struggling with their mental health in new motherhood. But we knew it couldn't just be us.
So we created this podcast because we hope that sharing these stories can start to break the stigma of mental health in our community and help heal the inner tigress in all AAPI parents. Hello, friends. We have covered a few episodes on postpartum depression before on Healing the Tigress. And so on today's episode, we wanted to bring a different angle to the topic and treatment options that we haven't talked about before. Our guest today is another fellow Taiwanese American mother who will be sharing about her ongoing treatment-resistant depression journey, her time at the Motherhood Center Day Program, and her experience with transcranial magnetic stimulation, or TMS, treatment.
Please help us welcome Stephanie Wu, who is an occupational therapist and perinatal mental health certified, or PMHC, professional. Stephanie works part-time at Lenox Hill Hospital in New York City and is the founder of Home Mama, a private practice dedicated to providing in-home maternal health support. And she offers home visits and community workshops. Stephanie, thank you for joining us today.
Thank you for having me.
Yeah. Would you please tell our listeners a little bit about yourself, your cultural background, and maybe a brief summary of your motherhood journey?
Okay. My name is Stephanie, and both of my parents are originally from Taiwan, but I was born in the States. And I became a mother May 2020 during peak pandemic. And then I had my daughter 2 years later. And so I have a son and a daughter. And I was diagnosed with postpartum depression about maybe 6 months in from when my daughter was born. And I have had quite the treatment journey from there that has been a little bit all over the place, honestly.
Yeah. We're going to dive deeper into that. So thank you for sharing.
So since your first child was born, in 2020 at the start of the pandemic, we've had actually a few episodes talking about what that was like to be a first-time mom during the pandemic. And then your second came, around the same time, but just 2 years later. You're basically doing the 2 under 2 and going through postpartum period back to back. When do you think you realized that some of the symptoms you were experiencing were more than just your typical motherhood experiences or feelings and that you needed to seek help?
I knew that I was very tearful when I first had my son, May 2020, but I just didn't know if that was because it was the pandemic. Like if other things had been different, maybe I wouldn't have been so tearful. But because, the circumstances were so bad, you couldn't see people or do anything or go anywhere. Everybody was worried about getting COVID. So, but at that time I did seek a support group, at the Motherhood Center. And that's how I learned about the Motherhood Center back then. That support group was enough for me to get through like the harder times. And I stabilized that way and I felt fine. And I don't really know officially if that would have been considered postpartum depression. But after my daughter was born, I actually had a really good first 6 months and thought like, I'm doing so much better as a new mom. But what I know is that I had periodic bouts of insomnia. And they'd be days, weeks, and I would just not, I would only get maybe a couple hours of sleep at night. And I know that can be a precursor. So, I would be very, very teary during those periods, but I thought it was just because of the lack of sleep. But then when the insomnia sort of resolved a little bit, I was just still crying so much all the time. And I just remember waking up and breastfeeding my daughter and just thinking wow, I just felt like the most profound despair. I'd look out the window and I just felt so sad. And that's when I sought help. I was like, I think something's going on. And so I saw a psychologist and she was like, you have postpartum depression.
We've had episodes where some moms are like, I didn't have your typical like depression, maybe symptoms. Like I didn't feel sad, but yours is kind of like that classic where, yes, you were sad. And sometimes I think we have gotten to the point where we're like, oh, postpartum depression is just so many different kinds of feelings. And like, we kind of dismiss the sadness now at this point where we're like, oh, but I'm glad you sort of described that, because that rawness of that despair, sometimes it's like inexplainable. Like, I'm supposed to be happy right now. I just had a baby, and like now I have two babies, and I should be so grateful that there's these beautiful lives, and like, why do I feel this way? And also the fact that this kind of peaked a little bit later. I think actually what we learned in our PMHC studies, right, all three of us, is that actually it kind of on average happens in the middle, like around 6 months, right? Not necessarily all in the beginning. So your case almost seems like a classic sort of case. And I know you and I have also talked about like what seemed to fuel your depression after the birth of your daughter was those bouts of insomnia. Can you describe what that was like? And like, what did you actually do to get better sleep?
Mm-hmm. What was the insomnia like? It's a lot of it was a lot of tossing and turning, frustration. I think it all kind of, the seed was planted because I breastfed both. And I remember a moment where, I started having more difficulty falling back asleep, like after I would breastfeed. In the early weeks, that wasn't a problem. And then over the course of time, that periodic schedule of getting up every 2 to 3 hours started to, I think, kind of affect my internal clock. So then it sort of grew into like, oh wow, so it's like, it's getting a little bit harder to fall asleep. And then it would turn into kind of like an anxiety about, am I going to have trouble falling asleep tonight? I was like counting the clock, where you look at the number of hours until you anticipate the next time the baby will wake up. And you only have a certain number of hours to sleep. So there's this like feeling of like sleep pressure. And so it just kind of like fed off of itself. And the only thing in the end that worked is I read this book. It's by this clinical psychologist. Her name is Shelby Harris. And I don't remember the specific title, but she specializes in sleep for women. And she wrote this book, and it's a whole like protocol. She introduces sleep, and then, how sleep changes as women get older across the lifespan. And she talks about how we develop insomnia, why people continue to have insomnia. And then she has you journal. So she gives a very specific structure for a sleep journal. And then she has you calculate all these things like the number of hours you were in bed, and then the number of hours you slept divided by the number of hours you were in bed. So it's a very, very specific, and she gives you instructions at the end. Like after a week of journaling, she says, okay, if this is what happened, this is what you should do. And I followed her protocol. And it took about a month, and I no longer get those nights where, I have like hours that I'm awake. The most it'll be is I get up and read for like 20 minutes or something, and then I go back to sleep.
We can get the title for you, and we can link it in our show notes for our listeners.
I swear by it.
I almost feel like it's like it sounds like almost like a self CBTI sort of book.
Mm-hmm. Yeah. Yeah. And for our listeners, CBTI stands for Cognitive Behavioral Therapy for Insomnia. And so it is a lot of actually doing tracking of hours in bed and sleep. And then also, like traditional CBT, challenging the thoughts that you have about sleep as you're kind of approaching those moments where you're looking at the clock or wondering how much you're sleeping. So we'll definitely link that information for our listeners too. And you mentioned in our kind of pre-interview questions that while you were working on your sleep with a sleep specialist, you noticed you were increasingly teary and sought out a new psychologist who told you that you had postpartum depression, and that, quote, therapy alone would not help. And I am wondering, especially as a therapist, when you hear that, it's like, oh, what does that mean? How did it feel to be told that therapy alone wasn't enough and that maybe you needed something more?
I think I was just surprised. I was like, what are you talking about? Like, I had never been on any kind of psychiatric medication before. I had had psychologists in the past. And I always just thought it was, medication is for people who are much more severe than that. Whatever it is that I'm experiencing, it can't be so terrible, that I need medication for it. And, I don't know where I think I got that maybe a little bit from sort of a little bit of my Asian upbringing of just sort of like minimizing, what you're experiencing and kind of just writing it off and I'll be fine, it's fine. Or this is normal, So, when she told me that, I was like, well, we'll see. So like, I just kept doing therapy for like a month or so and she just kept at it. She just kept like, we would meet and I would be like bawling and, she'd just be like, this is something that you can fix. Like you can work on, this isn't just burnout, she was like convinced that I wasn't going to get any kind of relief just from talking about it. So yeah, I took her word for it after like a couple months and then I started the medication journey.
So how long were you in therapy for before you guys decided to try medication?
Probably like a month and a half or so.
Okay.
Yeah.
That doesn't even seem that long.
Yeah, no, it wasn't that long.
Yeah, for her to like kind of be pressuring you to do that path. But at the same time, maybe she just saw the severity of maybe when you were presenting or when you guys were talking about things that she thought medication would help the therapy along.
I don't think that's uncommon. I definitely have had cases where probably in the first few sessions you do an assessment and you're like, I think I need to make a medication referral or like a psychiatric referral, because there are a lot of signs and symptoms where you're just like, if I'm not able to even get through in this session without the person really struggling to even take in what I'm saying, I think, like I've said before, sometimes medication kind of removes the cloud so you can see the coping skills. But if that cloud is just still there, you can talk all you want for a month and it's just not landing. And if you're really struggling, sometimes you just need that extra support to be able to utilize the therapy skills.
Yeah, and medication doesn't work right away, as we all know. So that's another reason why maybe like they wanted to start sooner so that the therapy sessions could actually be helpful or useful. But what you said about like the whole idea in your head in the beginning where you were like, I'm not this severe that I need medication. I think that's like a unfortunate sort of stereotype we place on medications, that like only when you're severe do you need to use this, right? And I do kind of feel like that's a little bit baked into our Asian culture, that our parents are always like, oh, like medication is last resort, right? I know for myself too. I think I also played on those feelings and thoughts. Now when I look back, I'm like, man, why was I so resistant to trying something else that could have helped earlier on? And even as a pharmacist, I feel like, man, I didn't believe what I was studying. Maybe, I don't know. It's very weird. Yeah. But I'm glad that maybe you tried, and we'll dive a little bit more into that later on about the medications themselves and how they worked for you. But as you sort of shared with us this journey of like trying medications and trying therapy and different things, I see that you decided to enroll at the Motherhood Center for their day program. So that was different than their support groups, right? Mm-hmm. That's after a few months of trying medications, you decided to do this, I see. So can you tell us more about what this program entailed and maybe some details for people who might feel like this could benefit them?
Mm-hmm. Yeah, so this program, it is a Monday through Friday program. It's from like 10 a.m. to 3 p.m. There's groups, there's art therapy, there's movement, there's individual consultation with a psychologist and a psychiatrist, and you meet with those individuals like 1 or 2 times a week. So it's quite regular contact. And I knew about this program from way back when I did the support groups, which were on Zoom with one of the co-founders of the Motherhood Center, Paige. And I thought about enrolling in that program many, many times before I actually enrolled in it. I knew it was there. I knew it could potentially help me. I think it's that same attitude of like, oh, that's for people who are really, really bad, and like my case isn't as bad as that. And, it felt a little bit like a luxury almost, to, take time off work to go dedicate to my mental health. And, it's interesting if it had been like a special type of cancer treatment or asthma treatment, it would have been a different, it would have been different than, I'd be like, okay, this is supposed to be a program that helps. Okay. I'm going to go do this, and it's going to help my asthma, and it's going to help my cancer or whatever. So I asked Paige quite a few times, sort of, or over the course of those, kind of the few months that I started feeling symptomatic. And then I was working with a therapist. I would ask Paige, do you think that I should join the program? And basically I did a big dance where, during the periods of insomnia, I would be like, okay, I need to do this program. And then when I didn't have the insomnia, I didn't think I needed the program. And so it was it basically was a dance until, I was working with a psychiatric nurse practitioner to manage my medications. And at one point, after having tried, maybe 4 or 5 medications, spring 2023, I guess, she said, I think we need to like consider like more support, because I think she realized she was like, unable to manage it on her own. So I was evaluated by a psychiatrist at the Motherhood Center, and then they told me, you are a good candidate for this program. And I told my employer I'm going to take leave, and that's when I did that. So I did that program for 2 months.
So the 2-month program sounds like you have to qualify too, because they have to evaluate you.
Yeah. And I don't know what the qualifying, criteria are. I do think probably depending on how severe your symptoms, maybe how medication treatment is going, whether you're even on medication at all, because I do think that some of my peers started medication once they joined the Motherhood Center. So I don't think that was like a prerequisite or anything. When I got there, I had no idea what to expect, but the main thing that happened is that the women that I met, I thought like, oh my gosh, like, where have you been all my life? Like I felt like these are my people,
Was there a wait list to get in even to the program? Or was it like, once you qualified and were able to take time off, it was pretty easy, smooth sailing to get in?
I don't know. I think it's possible that sometimes when there are more people trying to get in, that they might have a wait list, because I do think they have a cap on the capacity. So I think it just depends during the season when it's higher in demand or not. But I don't know the specifics.
It was like 15 people maybe per cohort or something like that?
So like when I started, it was kind of a smaller group of maybe like 4 to 5.
Oh, wow.
But then within like a couple weeks, there were like 12, 13. Okay. And then sometimes they'll split it. They'll split it into kind of like 2 different sections, so that you don't have like 12 women trying to, share about what they're going through that day and everything. So they would split the cohorts into 2 different ones.
Sounds a little bit almost like an intense IOP, like outpatient, right?
Intensive outpatient program.
Yeah. They refer to themselves as a partial hospitalization program. Mm-hmm. And since they do that in New York, they're the only ones, that provide what they do. And so I think that also helps in terms of coverage.
So insurance was able to cover that?
Yeah. So for me, they did what was called a single case, like inpatient. So cause normally they're outpatient, out of network, excuse me. And so they're out of network, but they were able to do like a single case in network agreement with my insurance provider at the time.
Wow. That's great.
Yeah.
So for a lot of these programs, I can see why that maybe there were only 4 or 5 at first, because if a lot of people are trying to pay out of pocket for it, that's probably really hard.
Yeah.
As someone who's worked in the insurance agencies before, you can request. So for any people listening that are like, I'd love to be able to use a partial hospitalization or intensive outpatient program, these are things you can advocate for insurance to cover. And part of the justification, like Stephanie, when you had shared, Like, why did they have to check qualifications? It's also that way they can justify with insurance as well to say this person needs this level of care. And part of it is also why it's called partial hospitalization, is it's not as expensive as being hospitalized. And it's a way to say, I want to divert this person from having to be hospitalized. They want to be able to still go home at the end of the day, be with their family, have dinner, sleep, in their bed with their baby in the bassinet next to them, right? And so this is a really great option for moms. And I'm surprised that there aren't more of them in New York, but that this is a really great option
or in the country.
Or in the country,
Yeah.
Mm-hmm. I know that in the Bay Area, there's, at least off the top of my head, I know there's one that I know of. And it's just, it's an intensive outpatient. And some of the differences, a partial hospitalization is, I think, typically 5 days a week. And then intensive outpatient is one step down, which is not as frequent during the week. And so it can vary in terms of, is it full day? Is it half day? But the premise of it is, like you said, some of the women in the program were just starting medications. It's a way to justify having daily or very regular medication monitoring versus if you're just seeing a psychiatrist and outpatient, they're not monitoring your medication titrations and doses like weekly or anything, right? They maybe see you once a month or whatever. It's a more safe way to do those kind of medication changes while also providing some support groups.
Was it helpful for you, Stephanie?
Yeah. Mm-hmm. It really was. It didn't fix it, but but they kind of tell you that, I think a lot of people go into these programs thinking they're going to get fixed. And I think a lot of people going through depression in general, maybe have this idea of being fixed when not everyone achieves that kind of like totally clean slate, like it's more about like managing the highs and lows. And so, yeah.
Yeah, instead of like conquering or beating depression, it's like, how do I coexist with this diagnosis? How do I adapt to my life to having this diagnosis? Which actually leads me to our next question, because, it sounds like after, like you said, the day program didn't quote unquote, you did air quotes. I know again, listeners can't see the air quotes, but that you went through the day program and that you had found a really good medication regimen, but it didn't quote unquote fix you, right? You started your own business, got your PMHC, and then something shifted. And what would you say that you noticed in terms of the symptoms or life circumstances that might have been contributing to what you felt like maybe your symptoms were worsening again?
I wish I knew what turned. I just know that there was a point where I was increasing Lexapro, which was the medication that seemed to be doing well for me. I think I was like plateauing almost. Like I started kind of regressing maybe a little bit, feeling a little symptomatic again. And, it was around the holidays that this happened, and the holidays are a hard time for a lot of people for various reasons. I don't know what happened, but I started, I started my business like fall 2023, and I was like doing great around that time. I filed for my LLC. I did my website. I was so inspired. I was, getting out there, trying to get my name out there and market. And then in the new year, I still had that enthusiasm, but yeah, I was navigating what felt like a regression of symptoms. So that was like January, February 2024. And I started working with a new psychiatric nurse practitioner at the time because of insurance reasons. And so she and I ended up working together and we switched. So I switched to Prozac. But that actually, we did like a pure switch. Like literally, like let's say this morning I took Lexapro and and she's like, we're going to switch to Prozac. And so tomorrow I took Prozac the next day and I didn't take Lexapro. I just switched just like that. And I hadn't done that with any of the other medications. I had done, kind of like the gradual taper or cross taper or whatever. And, I just did what I was told and I spiraled like within a month that I had and that was maybe more, I think, environmental and other things like in my life, sort of some stuff with my family, like kind of it all came together. Where I that's when I started getting like much more suicidal.
And I think you mentioned that you even had to go to the hospital for that episode, huh?
Well, actually, that was a later episode. So that episode, that was the first time it had been suggested to me. to go. My nurse practitioner said, like, do you want to go to the ER? And I was like, I don't know. We were on the phone with my husband, and at the time I didn't. And I kind of got through that. But that's when she says, I think we have to up it. And so we discussed like two options, like beyond medication. So we discussed ketamine, and then we discussed TMS. And ketamine's like $500 an infusion, or sometimes you have to go back for maintenance infusions. And so it just, to me, it struck me as like not a sustainable treatment option at the time, although I've heard wonderful things about it. So we ended up going with the route of TMS because it was covered by my insurance.
Is this the point where they deemed it as treatment resistant depression?
I think so.
Okay.
Yeah. Once, we had gone by that point, I had probably tried like 7 8 medications. And I think you need to have tried a certain number to even qualify for TMS. They're not going to do it for you if you've like only been on Zoloft.
Right.
So yeah, that's kind of around the time then.
Okay. And then you said, so you guys chose TMS because of kind of the insurance was part of it, right? I had been sort of looking into TMS too and saw that actually it was FDA approved in 2008. So it's actually a relatively newly, I would say, approved sort of treatment for treatment-resistant depression. So I am curious because I don't think I actually know of many patients who, or experiences or heard personal experiences about people who have done this. And I'm sure our listeners might be curious too. Would you mind sharing with us, like, if it helped and what the entire experience actually entailed?
Yeah, sure. I think that, so the experience of TMS was, first you consult with the psychiatrist, and, you talk through your full history. And then based on that, they decide whether you're eligible, and they do, they check when your insurance for coverage, all that. The first day you go in, it's a big machine, and it's got, like a hard helmet but they've also got like this kind of sort of like a beanie hat that they put on you first, and it's got all these lines. So I think like it lines up with the helmet in a certain way. And they do a calibration that first visit, I believe, to see like precisely the right location and then precisely the right frequency and intensity and all that kind of stuff that suits you. And they make the decision based on like something related to like your motor threshold. So they look for a flicker in your finger to determine like the right amount. I don't know why some people have a lower motor threshold than others, and so then they don't need a very intense treatment, and it's supposed to be effective. Of course, I got told I had a high motor threshold, so they just kept on having to like up it, and I was like, of course I have a high motor threshold. But after that, it was smooth going, and it was painful the first few. It feels kind of like, I mean, it's loud, and it feels like, I describe it as either a jackhammer or like a woodpecker, pecking. And it's on this one side that you feel it, but I think it's actually I think it's activating something on the left hemisphere. But it's just like this, just lots of like tapping. But you get real used to it, and then it's not a big deal at all after. You just get used to it. And I mean, I did it. You have to do it every day.
Wow.
So
how long?
I did it every day. I think most people do it for at least 6 weeks. Okay. But I ended up having, like, I switched insurances midway. So then I got extra like visits approved. So I actually had like extra TMS that not the average person gets. So I don't remember like how long I had Monday through Friday, but, and the treatment itself was only like, I think 12 minutes, So, but I was like commuting in from Brooklyn to Manhattan and then commuting back just for a 12-minute treatment. In the end, it was probably overall about 2 months of treatment. I think typically they do 36 treatments. That's kind of like considered to be the effective. That's what they've tested as effective. But I think I had 50. And I do think during the time that I was getting it, I do think it was helping with my mental health. And then I think what I noticed was that during talk therapy with my psychologist, we made a lot of breakthroughs on things like issues I had had with my family for years. And I've been talking about them in talk therapy for years. And then just during that summer, I was getting TMS. It was sort of like all of a sudden, like my brain let me like process in a more like effective way or something. I don't know how to describe it, but I really believe it. Obviously this is, just my own self-report, but I do believe that it allowed me to participate in talk therapy in a new way, where I kind of learned new things and new ways of looking at things that were helpful for my future. One time I had a session with my psychologist and she called it a breakthrough. I'm doing air quotes now again. But she called it a breakthrough. Because there was just this thing that I was like, oh, and I realized something about my life, and and she was like, oh my God, yes. So I don't know, I think I like to think it helped somewhat.
I love that even through all of the different treatment modalities you had to do, whether it was switching 8, 9, 10 different medications, doing a day program, now TMS, that you actually, it sounds like, had therapy ongoing throughout this whole process. And I think that's the important piece too, is that all of these things are what's like the perfect combination of treatment for every person, right? For some people, maybe a day program doesn't work for them, or maybe for some people, they only want to do therapy. And there are people who I think really could use medication and they choose not to, and they just do therapy, and maybe it's just a little bit harder. But it is this combination of all different ways to look at how to treat your depression, all the different facets of it, because it is so multifaceted. It isn't just, oh, we just need to talk about your family of origin and you'll be cured, right? Like, it's so many pieces. There's so much going on neurologically, biologically, and all the things, like hormonally because of postpartum. And there's so many ways to look at how we're treating depression, and it's not just one way.
Yeah. I almost wonder if you had maintenance. I don't know if they do maintenance TMS, if that might have prolonged or continued these sort of breakthroughs that you're having in talk therapy. Was that ever brought up as an option?
I think they don't technically do there's no research on a maintenance, but I think what people will do is they'll go back a year later or 2 years later and they'll do a whole treatment round all over again. And it'll last them, a couple of years. So, I mean, it's interesting because between that and what I've heard about ketamine, where, I know people who go back for, maintenance infusions every 2 weeks up to every 6 months. It's just astounding, how hard it can be to treat depression. I'm astounded all the time.
It's interesting you brought up if there's maintenance TMS, because the other question I had was also the option of ECT, which is electroconvulsive therapy. And usually that's started while someone's inpatient because they have to do it very frequent. And then when they're discharged, then they would do maintenance on an outpatient level. But I'm curious because TMS only being FDA approved fairly recently, although now that I'm thinking about what year it is, I'm also just like, okay, it's not as, but it's in the 2000s. But when I had used to work inpatient, ECT was way more common for treatment-resistant depression patients, and very rarely were we able to get TMS covered or referred out. And I'm curious if anyone had ever talked to you about ECT. That does involve some anesthesia, is my understanding, so there wouldn't have been a jackhammer feeling in your head, but it's much older. I'm curious what you know about it, if that was an option for you or not.
Yeah, very, very recently, I was talking to my nurse practitioner, and we were saying if I like ever had like a really bad dip again, she was saying like maybe you need to go back. I did my inpatient at NYU, and she said maybe you would go back to NYU and get ECT. I said I don't want to do ECT. I don't think I'm ever gonna. I have a friend who did it, and she said she lost large pockets of her memory. Yeah. And I mean, I've also heard, of cases where somebody had schizophrenia and they got ECT and they were cured. To me, it feels very risky. So, something that's so, I guess, brain changing, if you will. So I'm going to try to hold off on that one. I think if anything, honestly, now I would probably splurge on the ketamine if it came to that again, because I have heard it really helps a lot.
So you feel like since the fall, I know you mentioned you had like another kind of second spiral. You feel like at this point things are a little bit more stable, or what was there anything specific that you did differently you thought that might have helped?
Yeah. So after TMS, there were certain like circumstances in my life that I think were maybe stressors, the level of support I felt like I had from family. And so I think that fueled the next spiral. But I think I'm trying to remember what that last spiral was like. I kept, whenever I do feel low, I think everybody who has their low moments their brain might go to a different place. Like, and my brain happens to go to suicide. Like, it's just like second nature, like when I'm feeling low. Whereas I imagine maybe there's somebody else out there that decides to pick up and move or drink alcohol or do drugs or whatever. And I got just so tired of having that happen, that also I think was like a self kind of fulfilling cycle where I was just like, I don't want to have these thoughts anymore. And then, then I would start to feel hopeless and despair. And when I ended up feeling really, really terrible, I think there was a day where I just said to my husband, I think tomorrow I might like check myself in the hospital. And then I was like, I guess I'm going to see how I feel tonight. And in the morning, like I took the stroller and took my daughter to school and I dropped her off. And I remember thinking as I was pushing the stroller, I was like, I really don't care if I die. And I don't care if I get hit by a car right now. And that's when I said, I need to take care of this. So I got home and I said to my husband, I need to go to NYU. So we got in an Uber or Lyft and we went. And I think what has improved through that is that they monitored me while they added in lithium, which is a mood stabilizer. It's very commonly taken by people who have bipolar disorder, but I'm not told that I have bipolar disorder. But that I think has been a sort of a game changer. I think now I'm on a combination. I still take 4 different substances right now. Mm-hmm. I take Klonopin at night before bed. I take Prozac. I'm still on Prozac. I take the lithium, and then they added in a birth control more for the hormonal to regulate hormones, just in case like it's related to like the menstrual cycle at all. And I'm much more stable, I would say, like since then, basically.
Yeah, lithium can be used for, I think, kind of like a last line add-on for depression too. Like you said, it's not as commonly heard of, and most people will associate it with bipolar, but yeah, it is a mood stabilizer. Maybe that's the part you need, and that's okay. Thank you for being open about sharing that, because I know it can be so stigmatized to like talk about what medications you're on. Like for the longest time, it was hard for me to even tell people that like I was on Seroquel for sleep. So because I'm like, well, that's a technically in the class of an antipsychotic, and it just sounds awful when you hear it like that. But it's that the effects of the medicine to help with sleep, like that was helpful for me. So thank you for sharing, and I'm happy that things are hopefully stabilizing and plateauing. We know you're still in recovery, trying to find kind of that right balance, and hopefully this is it. But yeah, what's something that you want others to know about this kind of depression that you're battling?
It's so hard to stick it out, but it's like, I don't know, for me, I have to, for my kids. I just imagining being abandoned by parents, it just crushes me. So I guess that finding, even if you don't want to, and even if it doesn't make you feel better, finding the reasons to keep trying, I think is really important in moments where like you're feeling like you just can't do it anymore. Finding the right friends to talk to. I think the people that well, for people who have been through it, I think is actually the best option, honestly, is to talk to people who have been in your shoes or had a similar experience. But if not, then other people who can respect and understand like mental health struggles, either because they know family members or they work in healthcare or whatever. There are people who are the wrong people to talk to. So learning that is actually that's a good piece of advice. I think learning the people that are not going to help you on your journey. And it's not necessarily their fault. It's just not them. They're not the right people. And so finding the right people, I think, is important.
I think you said it kind of well earlier too, that just like maybe accepting that just everyone is a little bit different. Like my treatment regimen and my whatever helped me get better, it might not help you get better. And maybe it takes a little bit more for you to find what it is. Everyone's life circumstances are different. Their history and their past are different, right? Family support, it looks kind of different. And it might be a long journey to work through that, but it sounds like one day at a time. You're doing what you can and putting your best foot forward. And that's all you can do. With a lot of this motherhood journey, I think that it comes back to that a lot. It's just like sometimes maybe today I didn't have a great day. Tomorrow's another day and I'll try it again. Right.
Yeah. And you don't always know, I think that's what's hard is you don't, it's not predictable all the time, whether you're going to have a good day or a bad day, but it makes all the difference. Like once you're having a good day, it makes all of the toddler chaos and, it just makes all of that so much more bearable. So it's important, like for anyone that's like, no, like I don't want medication, just, I guess, because there is this feeling that like paying attention to your mental health, I don't know, I still feel like it's like not luxurious, but just a little like a little indulgent, maybe, if the word would be right, which I think is not fair. And that's wrong because, other people suffer when you suffer, like when you're suffering, you're not the only one suffering and they don't deserve that. Your family and your friends don't deserve like a depressed version of you. And if you can get help, it's really important to.
Yeah. I think we culturally are kind of taught that it's selfish to put ourselves first or to think about our mental health. And we've talked about this in previous episodes, there hasn't been a model for that, but you're right. Other people will suffer when we aren't taking our mental health seriously. And it's almost like you're giving folks permission to go and do that. And like, even at your lowest, you were like, I need to go to the hospital. Like the fact that you were able to very unashamedly be like, telling your husband, let's take me to NYU now, right? Like there is this very intentional way of saying like, no, I have to take care of this. I have to do something now. So I appreciate that you shared your story and that it was, again, so multifaceted and it's not one boxed way of treating depression, and loved the things you would say to other people who want to know more about treatment-resistant depression or are going through it now. But more importantly, if you could go back to Stephanie at her, maybe the darkest, maybe it's the hardest times in this journey, the Stephanie today, what would she tell her?
Just keep going. Yeah. I don't know. I can't think of anything else.
And that's the whole thing we're saying, like one day at a time, right?
Yeah.
Because this is a season. And I think the hardest part of depression I've sometimes mentioned is that you feel like there's no hope, right? There's no light at the end of the tunnel, and it can be easy to catastrophize and just give up. But the longer you go through it, you realize there are glimmers and there is going to be light, and maybe you don't know exactly when it's coming to, or sometimes it doesn't seem like it's there, but the longer you push, one day you're going to look back and just be like, wow, I did that. Right.
Yeah.
So we thank you so much for being brave and vulnerable and sharing your story as you have been, not even just here, but everywhere, and helping other moms out too, even through what specialty you have to offer to other moms through your occupational therapy jobs and stuff, because moms need that too. If we had more interdisciplinary and comprehensive look at like everything a mom needs, like I definitely think OT would be one of those things that sometimes gets overlooked. I myself had hand struggles when I was breastfeeding. So
I remember.
Yeah, that pain, the physical part and the mental part are very closely intertwined. You cannot separate them. So thank you for what you do.
And where can our listeners find you?
Like, is that website or?
Yeah.
Mm-hmm.
Oh, okay. It's like, where can they?
Not physically, not where they can physically knock on your door and come on.
Don't give us your address.
If they're more interested in what you do with your business and OT and everything, where can they look you up or contact you?
So on Instagram, I'm at home_mama_NYC, and my website is www.home-mama.com.
Okay,
awesome.
That's fantastic. We will link those for sure. Thank you, Stephanie.
Thank you.
Thank you for tuning in to this episode of Healing the Tigress. The more we share these stories, the more we can help other AAPI mothers and partners. If you enjoyed this episode and would like to keep supporting this mission, please hit the subscribe button to the show and take a few seconds to leave a rating. An extra big thanks if you would also leave a review to boost our show visibility and help other AAPI folks find us.
You can also follow us on Instagram at Healing the Tigress, or even better, check out our Patreon at patreon.com/Healing the Tigress podcast to support us more. Inside the Patreon, we will be offering more bonus episodes, sneak peeks, and a community for you to help shape our podcast too. Thanks for being here.
Healing the Tigress is produced and edited by Peggy and Jasmine.
Music for this show is remixed by Dr. Tony Huynh of Tony Mixes.
Our intro music is a cover of You and Me by Z Avi, played by our co-host Peggy.
Our outro music is a cover of Green Island Serenade, played by Jasmine's sister.
Cover art design is by Dr. Angela Chung.